Um, so this talk obviously is in the necessary format for social distancing. We are all in our own homes on our laptops or phones or whatever we're on. And we kind of rushed this talk to get it into place while it can still potentially do some good. I wanted to get this information and advice out to people as soon as possible. So the topic is social distancing. We're in the throes of a pandemic. Every person, every business, every local and national government is having to make their own decisions about how to respond to it. And this talk covers what measures are actually effective to try to slow down the spread, how those measures work, why they're important, why you need to stay home, even if you're low risk and have no symptoms. The novel coronavirus, its name is SARS-CoV-2. The disease it causes is called COVID-19. It's an enemy that's hard for us to comprehend. We can't see it. It works faster, it spreads faster than we can readily understand because human brains are really not good at thinking about small percentages of really large numbers or about geometric progression. And thinking about the coronavirus requires both. So first of all, I want to get across that this really is serious. First of all, it's much more contagious than the flu that it sometimes gets compared to. There's a measure called R naught. It's written R sub-zero, but it's usually pronounced naught, which is how many people one infected person spreads a disease to on average. It's also called the reproduction number. And for an agent to be considered infectious, it has to have an R naught of greater than 1, or it would just die out. At the lower end of R naught is seasonal flu, which infects millions of people per year. It has an R naught of about 1.3. At the other end of the range, where we have really, really contagious diseases, incredibly easy to catch, we have measles. It's one of the most infectious diseases. It has an R naught of 12 to 18. One measles patient is likely to infect 12 to 18 other people. If you're in the same room with a measles patient, you are 90% likely to get measles. So we're really lucky this is not that contagious, but it's still quite a bit more than flu. Estimates of COVID-19's R naught vary, but they range from 2 to close to 4. So it's about 2 or 3 times as contagious as the flu. And the flu is pretty easy to catch as these things go. It's not really easy, but it's easy enough that we're worried. Also, it's got kind of a small fatality rate. I mean, 1%, 2%, maybe 3.8%. We're not quite sure what the fatality rate is, but it's somewhere in that range of like 1 to 4%. It doesn't sound like a big number, but because it spreads so easily, that number is a percentage of most of the population. It's not just a few people who catch it and then a few of those die. It's most people catch it and 1 to 4% of them die. 1 to 4% of 40 to 70% of the world population is a heck of a lot of people. The flu only kills about 0.1%. So we're talking about 10 to 40 times as many people as the flu. In addition, it's particularly deadly for elderly people and people with existing conditions that affect their heart or lung function, diabetes, or compromised immune systems from various situations like being pregnant or being on chemotherapy drugs. A number of things can affect the immune system. So if you're in one of those categories, you're at particularly high danger. 15% of the US population is over 65. 40% of the US population has chronic health conditions, although I didn't go and break those down to which kind of chronic health conditions. I don't know about you, but a lot of my family and friends fall in at least one of those categories, some of them several of them. And for the people out there who are going, oh, but it only affects old people, it only affects people who are already sick. You know what? If you think those demographics are just dismissible, I don't know what to say to you because I care about those people. And the loss to the world that we're going to experience of grandparents, elder statesmen, scientists, writers, artists is going to be enormous, along with the loss of people of all ages and circumstances with conditions that make them more vulnerable. So it spreads fast. It kills a larger proportion of people than a lot of other diseases that we're familiar with. And it's contagious before symptoms appear. There's an incubation period that I think I've seen it estimated at like 4 to 11 days, close to 2 weeks. So just saying, oh, stay away from people if you're sick, that's not nearly good enough because people don't know they're sick and they're already spreading it. In addition, many people are turning out to be asymptomatic. And I'll get back to that later about how we know that. Because it's a new disease, we don't have any immunity, we don't have a vaccine, we don't have effective treatments. We have things to treat the symptoms and try to get people through it, but we don't have any way to actually fight the virus itself. So that's kind of where we are with why this is scary. And I want to show you a chart about how it spreads. Because it spreads so easily, graphs of cases show a geometric curve. And now we're going to test my screen sharing ability and see whether I can get this up here for you. Portion of screen. Okay, can everybody see the graph?
Yeah.
No? Okay, great. Frame that slightly differently. Okay, so this is just a graph of cases in the US. And as you can see, it starts off really, really flat. There are just a few cases, there are just a few cases, there are just a few cases. Oh, there are a few more cases. And then it suddenly swoops up really fast. And that's not a kind of progression that human brains are really well designed to understand. We see this slow increase and we think of it like we'd think of an arithmetic increase. There are a few more cases, there are a few more cases. Not, now there are 10 times more cases, now there are 10 times more cases. And I think that a lot of the political response has been, oh, it's not that bad yet, without looking at the graphs in other countries and thinking, okay, we're going to be here on this date. So I think part of the problem is how quickly it ramps up. So let's see, we don't need that. Sorry, I will stop share. So because it ramps up so quickly, even countries that have really robust national healthcare systems are finding their resources totally overwhelmed by it. They end up with way more times, many more times people that are severely ill than they have medical resources to treat them simultaneously. About 14% of cases of COVID-19 are severe, requiring hospitalization. And when I say severe, that doesn't mean that the people who are staying at home are not feeling really, really sick. That means that they actually require hospitalization in order to survive it. And about 5% need intensive care and a ventilator in order to breathe. They would die without it. So as soon as that 14% and that 5%, as soon as that percentage of the cases that you have is more than the medical resources that you have in your area, then everybody who's over that line is going to die, or almost everybody. Some of the severe cases might get through, but the people who need a ventilator, they're not going to make it without a ventilator. You've probably all seen some version of the flatten the curve graph. It's gotten really popular, which I think is great. It's a really good way of understanding it. Let me get that up here. Here, this one. Okay. So the basic idea here is the red is that exponential curve that we see if we don't intervene promptly and effectively. The cases rise really fast. There's a very high peak. And if we do implement really successful suppressive measures, we get a much slower curve we get just as many cases maybe, because eventually most people are going to catch this, but they happen over a longer period of time. And I think one of the most important things about this graph was a later addition. The bumps, the red and the blue bumps were created first. And then I believe this was Drew Harris who added the healthcare system capacity line to understand the importance of flattening the curve. The healthcare system capacity line there aren't any units on this graph. If you put in units, it becomes much, much scarier because healthcare system capacity is really, really low, and we're probably still going to outpace it with cases, even if we do all the suppression we can. But the theory is we try to slow down the cases, and then we try to keep it within the capacity of our healthcare systems. Because we don't want the people up in the top of that red where they can't be cared for and will end up dying if they have severe cases. So back to stop share. So let me show you a comparison of, well, actually, let me tell you a little bit about Italy first. Italy has a robust healthcare system. And yet they have been completely swamped by the number of cases, to the point that doctors are every day having to decide, do I give this person a ventilator or this person a ventilator? Because I only have one, and I have to decide whether I can save this person or not. If I can't really save them, I need to give the ventilator to someone else. If I might be able to save either of them, I have to decide whose life is maybe more valuable. I mean, these are decisions that no doctor should ever have to make. And trying to make those ethical decisions when you just are trying your damnedest to save everybody, because that's your job and your passion. It hurts me to think about the doctors having to make those decisions in addition to running themselves ragged every day trying to save people. So I want to show you where Italy is or was when this graph was made and where we are on the same scale. So this is from Vox, and this is showing the blue curve is Italy starting on its day 1, which is February 23rd, and going to its day 26. And you can see their cases swooping up. And here's the United States in red starting on March 2nd and coming up to its day 18. And if I go up here, you will see what has happened in Italy up till March 18th. And that's where we're going really, really soon. We're on the way. You can see the United States has actually an even sharper curve than Italy suddenly. And there's no reason to think we're not going to do exactly the same thing as Italy here. In fact, we're probably going to do worse than Italy because we have even less testing and less healthcare support and less governmental organization about it. So anybody who's looking at United States cases and going, well, it won't be that bad, there's absolutely no rational foundation for thinking it won't be that bad. It's likely to be at least that bad and worse. So now that I've thoroughly scared everybody who wasn't already aware of all of that, the thing is, this curve and COVID-19s aren't constants, or the call to flatten the curve would be pointless. They are actually conditional, they're circumstantial, and they can be affected by how people are behaving and the decisions that individuals and organizations are making. So I'd like to show you some simulations that I think are pretty genius from a Washington Post article. You can look this up yourself and play with it. It's not just animations, it's actually simulations. So it'll play out slightly differently every time. And it's a simple simulation in the sense that it's not attempting to simulate the actual COVID-19 behavior and percentages. It's just taking dots and bumping them into each other. And when when an infected dot, an orange one, bumps an uninfected greenish dot, it will infect it and turn it orange. In this model, the dots eventually recover and turn pink. None of the dots are going to disappear or die in this model, but it shows the spread of an infection. So first, I'm going to show you an absolutely unimpeded infection model. And I will wait for this to finish because it has to do its own little simulation. And then I'll start a new one. Okay. So here is a town of about 200 people, and they are all healthy except a couple in the middle there who start off bouncing around, and as they hit the healthy green people, they are spreading the infection madly throughout everybody, and eventually everyone has it. It happens terrifyingly fast. And you can see the curve up at the top. This shows that same curve that we're talking about. It's on a somewhat different scale. So if we were scaling it the same way we were showing days, that would be, well, obviously it happened in seconds. So it's a very steep curve. And there, finally, everyone's recovered. Now, if we go on and we try to intervene with this, here's an attempt at quarantine. We've got a few infected over on the left. They tried this in Hubei, where Wuhan is. The problem with quarantine efforts is that it's pretty hard to keep them perfect. As you can see, this one's now broken open. A couple people came out of quarantine, and now you're going to have the same situation on the right that you had on the left. So quarantine would work if you could keep it perfect, but people are not perfect, and so in practice, you might be able to slow it down a little bit, but you're going to have the same situation on the right as well. Now, let's look at social distancing. With social distancing, we've got people having somewhat less contact. And I'll talk about the specific steps of that a little bit later. But here is social distancing. Some of the people are holding still. In fact, most of them. I think it's 3/4 in this model. And when they are staying still and not bouncing around, they are getting infected much more slowly. Note that the infected, 3/4 of them are also staying still. They're not bouncing around and infecting people. People are gradually recovering now, and we've still got people who haven't even been infected yet. You can see how much flatter the curve is at the top. So social distancing makes a difference. It slows things down, it flattens the curve. Here's something even more effective. We've only got 1 in 8 people moving in this model. There are only a few people going around. Maybe they're making deliveries. They're going to their absolutely critical jobs. Most people are hunkered down. They're sheltering in place. And the curve is very, very flat. Obviously, this is simplistic. This isn't real human behavior, but it's really easy to see how this works. So I want to talk about the specific steps that can make us like those still dots and keep us from spreading the virus, and how that works with different countries' approaches. What works to stop it is not a mitigation approach like the UK attempted, which has been really disastrous. You have to be aggressive with the suppression. South Korea and China managed much flatter curves with widespread testing, quarantines, strict isolation, distancing rules. Italy and the UK both took less interventionist approaches and have suffered really steep increases that have swamped their healthcare systems. And the US, as I mentioned, is in even a worse state than most countries in Europe because we don't have a national health system. We don't have a safety net for workers, so a lot of people are going to work even if they might be sick or even if they would rather stay home. And there's no coherent national response. So every state, every city, every school district, every business is making its own decisions kind of in a vacuum and waiting for a response from higher levels, and mostly not getting it. So, and they're making those decisions slowly because they don't have central guidance or support. There are a lot of things that governments can and should do, and there's a really good article, I believe it's a Washington Post article called "The Hammer and the Dance," which I strongly recommend everybody read to help you understand the differences in government approaches and what we should be telling our governments to be doing. But I'm not going to go into that part in detail right now, because what I want to talk about is what you can do regardless of what your government is doing. And the basic answer to that is isolate yourself as much as you can, as soon as you can. We're all home right now rather than going to church, so that's a good part of it. Here are some specific pieces. Some of these steps have been imposed governmentally in some places, but not in others. For example, we have schools all closed in Washington right now, but they're still open in a lot of states. And there are other states, there are other steps here where some of them are being enforced here and not elsewhere. Some of them are not being enforced here yet, and I believe they should be. But even if they're not, you should do them yourself. Here are some steps that fall in the category of social distancing, which helps some, but not enough. So at least do these. Let's move on to the stronger ones in a minute. First of all, don't gather in large groups. Parties, theaters, restaurants, bars, sports arenas, beaches, all of these things, they're a terrible idea. There are still people out there on the beaches in Seattle right now. Get off the party beaches. This is not a good idea. Better yet, don't even gather in small groups. Don't shake hands. Don't otherwise touch people unless you're already at home and have shared germs, and there's no point. But don't go out and then touch somebody. In fact, stay 6 feet away from them at least. If you have to get closer for some reason, like you're trying to get by them in a store aisle, turn your face away and give them as much space as you can. So that's pretty much social distancing, which is kind of a mild personal approach to it and has been recommended in some places, but we need to be doing more. And in Washington, we are starting to do more. Self-isolation is the next category. We need as many people to do it as possible, and it's especially recommended if you're in a high-risk category. California has imposed this now by its shelter-in-place order. I guess it's not self-isolation if it's imposed, it's shelter-in-place. But it's basically the same thing. You don't visit, you don't have people over, you work from home or you stop working. You keep kids home from school, you don't get them together for play dates, you don't let them play on playground equipment because it could have the virus on it. You don't go shopping, you have food and other supplies delivered. In some places that are doing shelter in place or doing somewhat modified versions of it, you can go shopping, but only at certain times and only one person from each household. And they have like spacing rules. But ideally, you're not shopping at all if you can manage to get things delivered or live on what you have in your house. And of course, all of these steps are in addition to conscientious, constant hand washing, sanitizing your surfaces, covering coughs and throwing out tissues, washing your hands again, washing your hands after you wash your hands. You know, it's starting to get to the point where we are aware of the need to moisturize after we wash our hands. But I'm talking about the spacing part of this here. Okay, so this sounds really inconvenient. It's really disruptive. It's a problem for the economy. It's a problem for my mental health. Do I really have to do all this? Yeah. Even if you're not symptomatic. I mentioned that a lot of people are asymptomatic. There's a study that compared numbers from Italy, where only symptomatic people have been tested. In the US, not even symptomatic people are getting tested. With numbers from South Korea, which has really widespread testing. And the comparison of the two showed that there's a very high number of asymptomatic infected people in their 20s that are not getting detected if you only test symptomatic people. As many as 20 to 40% of infected people may not show any symptoms, but they could still spread it. They might also suffer damage to their lungs that we're not aware of at this point because we don't really know what the lasting effects of this are going to be. Yes, even if you are not yourself in a high-risk category, you can still spread it to people. You can spread it to people who don't even know that they're vulnerable. We've had apparently healthy young people, such as athletes, die of COVID-19. Sometimes because they had an undetected health condition. There was one who had leukemia, one who had a heart problem. They didn't know it yet. So they didn't know they were in a high risk category. And sometimes people just get unlucky. They get a severe case and it doesn't respond to treatment, or maybe treatment's not available. And we'll get to that again too. And yes, even if your workplace, your school, or your local government has not yet ordered it, most businesses, school districts, and governments are responding way too slowly to this. They're responding too tentatively. They're afraid of overreacting. It is way too late for overreacting. Almost everyone is underreacting at this point. But when there's no central leadership, what we get is a whole bunch of people worrying about social effects and economic effects, which are real. They are real problems, and they're bigger problems because of the kind of capitalism we have. We don't have a safety net for people. So people can't afford to stay home. They can't afford to say they're sick. So we're in a worse state than a lot of countries are as far as response. But since you can't rely on governments and institutions to tell you, respond this way, you need to be able to make the decision to respond in the responsible and rational and compassionate way. We also need to be able to make decisions to support the people around us who maybe can't afford to quit work, and I'll come back to that too. What if you can't isolate? A lot of people can't. Actually, before I get to that, what if I feel guilty about isolating because it's my privilege that I can isolate when other people can't? Shouldn't I support them by suffering the same conditions they are? No. If you can isolate because that helps keep everybody safe, especially the people who have to be out delivering or doing healthcare work or hauling garbage, all those things that we really need people to be doing right now. When you stay home, you help keep them safe. You keep people safe who are gig workers who can't afford to stop working. You keep people safe who need to do childcare for the people who are healthcare workers. You take care of the homeless who have nowhere to go because the community centers and libraries are closed. If you go out, you're increasing their risk, not supporting them. If you feel guilty about having the means to self-isolate when some people don't, there are ways you can help. You can donate, you can buy someone takeout food, you can make masks. There are people who are accepting masks for hospitals, and you can look that up, the specs and who's taking them. What if you yourself can't isolate? Maybe you're a critical worker, or maybe you can't afford to stop working. Your boss insists you keep working. First of all, if you are a critical worker, bless you right now. Thank you. Please do everything you can to keep yourself and the people you come in contact with safe. And the rest of us will do our best to support you by staying home and not getting people sick, either you or people you come in contact with or ourselves. The more you keep yourself healthy, the less you overburden the healthcare system. What about people who want to quit, really want to stay home and isolate, but they can't lose the income and they can't risk being fired? Well, a couple things here. One, your job may be about to shut down anyway. It may be shut down by the government. You may not have a choice because schools, gyms, restaurants, theaters, stores, they're shutting down all over, either by government order, by the owner's choice, or because there's simply a lack of business because no one's going to them. So think about that if you quit now, it may not make much of a difference to your income in the long run because it's going to be shut down within a week anyway. But it may make a big difference to your other people's health. That's a really rough choice to make, though, so I understand if some people feel that they need to keep working. Some businesses are pivoting to provide different kinds of services or provide them a different way. Offices having people work from home, schools providing distance learning where that's feasible, restaurants switching to selling takeout or even selling toilet paper and groceries. Whiskey distilleries several of them are making hand sanitizer now, which I think is wonderful. So think about what your job is and whether you can convince your employer to change it to something that can be done remotely or a completely different job that could continue safely and productively through the crisis. There are cases where you might be able to come up with something that would actually improve your job. If you do have to stay home or you decide to stay home, even though your boss wants you to work, apply for sick leave or unemployment. The rules are getting changed so that these are available in a number of circumstances related to the pandemic where they were not previously available. Even if you're part-time, or if you're not sick but you're taking care of someone who is, or your house is under quarantine, or your workplace is closed because of the virus, or you're staying home to self-isolate but your boss wants you to come in. Some of these situations, you may still be able to get either sick leave or unemployment. So look up the current rules for your area and how that applies to your situation. And if you've lost work or left work because of the epidemic, go ahead and apply. It's not entirely clear how the new rules are going to apply to particular situations. You might as well apply. So yeah, that's the toughest situation, is if your boss is saying come to work and you can't afford not to. But there's some possibilities there. So in summary, isolate as soon as you can, as much as you can. Don't wait for orders from someone else. We want to be